A mental health patient in Auckland City Hospital was made to wait 94 hours in an emergency department because there were no beds available in the psychiatric unit, according to a damning internal email obtained by the Weekend Herald. Anecdotally, it may be the longest ever stay for a mental health patient in New Zealand ED, the doctor said. 2 other acutely unwell patients were marooned in ED at the same time. They waited 58 and 65 hours to be admitted to Te Whete Tāwera, a 58-bed inpatient psychiatric facility, the email said. So this, to me, is twofold. This shows you the absolute crumbling nature of our EDs, literally the ambulance at the bottom of the cliff, but also too it goes to highlight that where was all this money that this government was supposed to be spending on improving the number of beds in mental health?
Yeah. How much was it? Was it 500 million?
They're saying here staffing shortages have become so critical in some places that wards were struggling to deliver an adequate level of care, avoiding harmful mistakes and protect staff from patients who are abusive and violent. Extraordinary delays for these patients happened soon after Auckland City's hospital ED became overcrowded in March, that some people were moved into the public space designated as an overflow area of mass casualty events, and several ambulances were diverted to another hospital. Even goes without talking about the ramping that goes on at these hospitals as well.
What's ramping?
So ramping is when an ambulance arrives with a patient on board, but it's so full in ED and there's no staff available to even take that patient in for triage that they will not accept the patient into ED, and the paramedics have to hold on to that patient in ambulance until they can be released inside at ED. So
that'd be a lonely feeling, wouldn't it?
Yeah, and I know that that has been leading to some of the delays for people with call-outs. So then I know Waikato have been hit with this pretty intensively, and you could have 8 ambulances ramped at ED waiting to offload patients who are in the ED saying, no, we can't take them. And then you've got more emergency call-outs and you've got no ambulances for call-out because they've still got patients on board.
Again, go through the Ministry of Health's expenditure and just say, okay, do we sell ramping or do we have this cultural safety department that's sucking $20 million a year or whatever? You can hear the bureaucracy defending itself rather than figuring out how to solve the problem.